Hello everyone, today the topic which we're gonna study is osteomyelitis. So what is osteomyelitis? Let's dissect this term. The osteo mean bone, myelo mean bone marrow and the itis mean inflammation. So what is osteomyelitis? Osteomyelitis is inflammation of bone and bone marrow. But this inflammation is almost and always due to an infection. So the osteomyelitis is also called as infection of bone and bone marrow. So what causes the infection of bone and bone marrow? There are a wide variety of organisms which cause osteomyelitis. The most common one is Staphylococcus aureus. About 80 to 90% cases of osteomyelitis is caused by Staph aureus. Apart from Staph aureus, there are certain different organisms which affect different class of people. For example, in neonate, the most common organism is Haemophilus influenza and the group B streptococci. While in sickle cell disease it's a salmonella, in diabetic and IV drug user it's pseudomonas, while in a sexually active man it is a gonorrhea. Remember that apart from these organisms, the mycobacterium tuberculosis also caused osteomyelitis. The osteomyelitis caused by mycobacterium tuberculosis, when it involves the vertebrae, it is called as a Pott's disease. Now a question arises that how these organisms will reach the bone. These organisms reach the bone by three mechanisms. The first one is the hematogenous spread, the second one is the direct extension from contagious site, and the third one is direct implantation. So what is meant by the hematogenous spread? In hematogenous spread there will be a infection some other site, and there will be, as a result of this infection, there will be a bacteremia. So due to bacteremia, the infective organism will reach the bone, causing osteomyelitis. It is the most common way of osteomyelitis in children, and the most predominant site it involves is a metaphysis in children. But heterogeneous spread can also cause osteomyelitis in adult. Why? But in adult it involves epiphysis. The second one is extension from contagious site. So what is meant by the contagious site? By this we mean that when we have an infection such as diabetic foot ulcer, decubitus ulcer, or any other kind of a soft tissue infection, due to this infection the infective organism will spread to the bone and cause osteomyelitis. It is the most common cause of osteomyelitis in adult, primarily in those patients who have a diabetic foot. The third one is the direct implantation. So what we meant by the direct implantation, in this when we have a certain orthopedic procedure, during orthopedic procedure due to aseptic environment, the organism can spread from surrounding to bone, causing osteomyelitis. Osteomyelitis are divided into two types, acute osteomyelitis and a chronic osteomyelitis. In acute osteomyelitis, there will be infection of bone that has not yet progressed to that extent to which it will produce a dead bone. Mean that in osteomyelitis, without a production of a dead bone, is called as acute osteomyelitis. While in a chronic osteomyelitis, there will be an infection associated with bone death. So chronic osteomyelitis is osteomyelitis plus dead bone. So how will a patient of osteomyelitis present clinically? The patient will present with a bone pain with localized tenderness at the site of infection. Along with that, there will be a sign of a systemic toxicity such as fever, fatigue, night sweat, etc. There will also be a draining sinus, but this draining sinus mostly occur in chronic disease when there is a formation of involucrum and sequestrum. Now come toward the diagnosis, that how we will diagnose a patient. For that we perform certain tests. The first one is an MRI. MRI is the investigation of choice for the diagnosing osteomyelitis. Apart from that, we can also perform X-ray, but X-ray is usually not beneficial in acute disease because the radiographic changes such as lytic lesion and periosteal thickening are usually not evident on X-ray for at least first 10 days. So for this instance, MRI is usually the best and the initial test for the diagnosis of osteomyelitis. Apart from that, we can also perform needle aspiration and bone biopsy. It is the most accurate test for the diagnosis of osteomyelitis. Along with that, we can also perform a culture on the bone biopsy, and in this way, it will help to determine the specific antibiotic therapy. Apart from MRI, which is the best and the initial diagnostic test, and the needle aspiration and the bone biopsy, which is the most accurate diagnostic test for osteomyelitis, we can also perform the white cell count, ESR, and the CRP. The white cell count will usually be elevated, but it is not usually very helpful in diagnosis. Apart from that, the ESR and the CRP are usually used for monitoring the response to therapy. Now come toward the treatment of osteomyelitis, that how we will treat a patient. For treatment, the antibiotic is a mainstay of therapy. But the question arises that what kind of antibiotic we should use? The answer is the antibiotic choice is based on culture and sensitivity. But culture and sensitivity take time. So during this time we can provide an empirical therapy. In empirical therapy, we use antibiotic who act as a bactericidal, which penetrate well into bone and include coverage for Staph aureus. It includes vancomycin, nefcillin, or cephalexin. According to the recent research, linezolid is a drug of choice for osteomyelitis because it acts well on the Staph aureus and have a good penetration to bone and soft tissue. After culture and sensitivity, if the cause of osteomyelitis is methicillin resistant Staph aureus, then we can continue linezolid. But if there is a gram-negative rod are included in the cause, then we can add ceftriaxone, cefotaxime, or cefepime. This treatment is usually continued for 4 to 6 weeks. Other than antibiotic, we can also use the limb splinter and analgesia. The limb splinter is used to splintage the affected limb, so by this way we can prevent the soft tissue contracture, and the analgesia is used for the pain relief. The last option for osteomyelitis is a surgical treatment. The surgical treatment is usually performed for chronic osteomyelitis. So now we will study chronic osteomyelitis briefly, and after that we will study the management plan for how we treat chronic osteomyelitis. So what is chronic osteomyelitis? The chronic osteomyelitis is infection of bone associated with bone death, and it occurs due to unresolved previous acute osteomyelitis or due to the repeated attack of osteomyelitis, which will result into dead bone. In chronic osteomyelitis, the bone acquire a two characteristic feature called as sequestrum and involucrum. So sequestrum is a macroscopic piece of dead bone, while the involucrum is a new bone formed around the area of osteomyelitis, and it is usually produced in response to perosteal stimulation. So let's elaborate these two conditions. For example, this is a long bone affected by the osteomyelitis. The microorganism will produce a dead bone called as a sequestrum. Why they produce a dead bone? The dead bone is usually become an avascular structure. So the antibiotic or any other defense mechanism will not reach the sequestrum. So it will be an ideal site for organism to live. In response to the sequestrum produced by a microorganism, there will be a perosteal stimulation. This perosteal stimulation will lead to formation of the involucrum. Involucrum is produced by host to prevent the spread of microorganism. So the sequestrum and the involucrum are usually a characteristic feature of chronic osteomyelitis. The sequestrum being a response of a microorganism, while the involucrum is a defensive mechanism produced by a host. And these clinical features are usually found on MRI. So the MRI is the investigation of choice for a chronic osteomyelitis, and the blood tests are usually normal in chronic osteomyelitis. Now we will study the management of chronic osteomyelitis. Management of a chronic osteomyelitis, we use a Cierny and madar classification. In this classification system, the infection of a bone is divided into 4 stages, and this 4 stages is related to the condition of a patient. The condition of a patient are divided into 3 groups. Group A are the people who have a no active disease, the group B are the people who have a compromised state, and while group C are those people who have a severe comorbidity. In these patients, the surgery is more dangerous than osteomyelitis itself. And the infection of a bone are divided into 4 stages. The first one is stage 1, called as a medullary stage. In this, only a cancellous bone is involved. mean that only medullary portion of a bone is involved. To treat this condition, we excise the dead bone by carrying out the intermedullary reaming or windowing the cortex. So what we do, we create a window from medullary portion to the outside. We remove all those dead bone, and the defect which is created by removing the dead bone is filled by antibiotic loaded cement or absorbable pellets. In stage 2, also called as a superficial, in this stage only a cortical bone is involved. The cortical bone is the outer portion of a long bone, so it is usually involved and it is associated with skin ulceration. To treat this condition, it required complete excision and local or free muscle flap. If the more than one third of a cortical circumference is excised, which is essential to perform a splintage, usually with external fixation, and it will help to prevent fracture. Stage 3, also called as a localized. In this stage, the both cortical and the medullary bone is involved, but only the limited area of cortical and medullary bone is involved, and it usually requires a radical excision. After radical excision, the stage reconstruction is necessary with cancellous bone grafting. The last stage, stage 4, is called as a diffuse type. In this, the both medullary and the cortical bone is involved, but the involvement is circumferentially, mean the whole of the medullary and the cancellous bone is involved. To treat this condition, we perform a segmental resection, and after that we do bone reconstruction. So it was all about the staging of osteomyelitis. In stage 1, only medullary bone is involved. In stage 2, only cortical bone is involved. In stage 3, medullary and cortical both bone are involved, but only localized lesion is present. While in type 4, the cortical and medullary both bone are involved, but cover whole circumference of a bone. Also remember that after surgical treatment of a chronic osteomyelitis, we give antibiotic therapy for 6 to 12 weeks, but it can be extended according to a patient condition. And if the patient have a fracture, then the antibiotic should be continued till the fracture get union. According to the recent research, usually the local antibiotic is injected into bone, so it show a good result. Along with that, patient is also prevented from a systemic side effect of antibiotic. Along with antibiotic, there is also a administration of a biocomposed material such as a hydroxyapatite. So it will help to form new bone. So by the formation of a new bone into a defective bone, it is usually helpful and it avoid a secondary bone grafting. So it was all about osteomyelitis. If there is still any question, you guys can ask, and stay tuned for more update.